I actually said that we should be wearing masks in closed spaces where people weren't able to maintain social distance. I think it was 4 weeks ago on a government information session that was broadcast, and it was picked up by GBC and it was explained at that time. We felt the need to repeat that information because it was clear there was confusion. Some of the supermarkets, for example, have been practicing good social distancing. They've measured people coming in and they've got tracks that are single lane and people are able to maintain distances. I went to one of the other supermarkets the weekend and it was chaos, pandemonium, and clearly the message is not getting across everywhere. So like most things, we have to keep repeating because different people tune in at different times, hear different messages at different times. The issue about masks is outside spaces are generally safe. You don't need to wear masks. I know the message in other countries is different, but outside spaces are generally safe according to the evidence that we have. Inside spaces are less safe, and where you can't maintain social distance, wear a mask. But in the hospital, we can maintain social distance, so we don't wear masks. And in other departments where you can maintain social distance, you don't need the masks.
Do you regret not having advised it more strongly sooner?
Well, I think I said this, and I have said this consistently, it depends on where the evidence is. And, we've been on a journey over the last 4, if not 5 months, and the evidence has come in. And that evidence has changed, and you only need to go back and have a look at the evidence. It was very equivocal.
As you said, it's only a part of what helps prevent the spread of the virus. Perhaps you could explain how they can be used alongside other methods again.
So all of these are filtering mechanisms to reduce the spread of it. The most important personal one is hand washing, or gelling with 70% alcohol as frequently as possible. Some years ago there was an outbreak of influenza in Indonesia and they gave people, I think it gave them hand gel and asked everyone to use the hand gel once in the day. They reduced the transmission of influenza by 30%. Just by one hand. So that's how effective it is.
And so finally, perhaps a reminder on how people can actually use masks effectively.
So if you go to the Public Health Gibraltar website, you will find quite a lot of pointers around how to make a face covering, but also remember it's the loops that you put around, and sometimes there's a frame at the top which is to bridge your nose to make a seal. Try not to touch the surface because that's where you will collect the gubbins that are floating around, and it's not you don't breathe through your chin, you certainly don't breathe through your forehead. The purpose of it is to keep your breath in, so take off with loops, hand wash before you put them on, and if you're making your own face covering, which you can buy, wash them every day, please.